Hemorrhoids. Ugh, right? Even the word rubs most people the wrong way, but they happen. Well, what happens though? You'll know here in a few minutes and then we'll evacuate, okay? This is gonna be too easy. Hemorrhoids are dilated or swollen hemorrhoidal veins. Hemorrhoidal veins are normal around the rectum and the anus, just like any other tissue in your body. But when they become dilated, they can be bothersome and problematic. So who gets these dilated veins that are carrying blood around the anus and the rectum? Typically we'll see them in pregnant women, people that sit at their desk all day, people with lots of diarrhea, and definitely people who strain a lot with their bowel movements, like with constipation. Think about it, you're forcing out that hardened doo-doo on a regular basis, causing a huge increase of blood flow as you strain, and therefore pressure to the veins in that area increase a lot, causing them to swell. The hemorrhoids can be internal to where you can't see them, or external to where you can, or you can have both. Now you might say, yo Steph, I've never seen the inside of my cheeks, how am I supposed to check? Good question. Easy though. If you can take a selfie this high up like most of you do, you could take a selfie this low down. Just don't accidentally post it on IG because you might lose a couple followers. You might gain some too. But we don't want a famous anus, so you could just use a mirror. If you're in your car and driving, put your phone away. If you're parked, say you just dropped the kids off at the pool or something, don't try to use the rear view, okay? You'll either be in the ER with a back strain or admitted to the psych ward for being a person that would do that. But there's gotta be something to prompt you to check, right? And that's usually some pain or itching or noticing some blood in the toilet bowl after you duke it out, okay? It's the first indicator that something's going down. Now the water will typically be kind of pink or a brighter red. Here's the thing, keep your cool if you see the entire toilet bowl turn red. Even a couple drops of blood can do that. Let me demonstrate. A couple drops of blood can turn this much water bright red. Now, if you see a lot of blood in there or feel any sort of other symptoms like dizziness, cramping, trouble breathing, or you're looking more pale than usual, call for some help and get to the emergency department because it could be something serious. But regardless, if we're bleeding from our backside, we're getting some medical attention. Now, say we're feeling fine besides the pain, the itchiness, and a little bit of blood in the toilet bowl water, okay? It could likely be hemorrhoids, and you should see your licensed primary care provider. So what can we expect at the doctor's office? We'll take down a history as always, okay? We're all cool with that. What some of us ain't cool with is the exam. They're gonna have you drop trowel, get in a position so they can take a peek. They're gonna check the outside for any abnormalities and also do a digital rectal exam, meaning their fully gloved finger will be entering the darkness. Now I know a lot of you got a problem with this, but I promise you, this too shall pass. You may be nervous about it, but your provider doesn't think a thing of it. It's not like they're having coffee in the morning thinking, wonder how many rectums I'll get to examine today. Nor will they jump up and say, all right, let's do this. Let me say, if you got a provider that's that stoked about their job, you scored. Okay, your provider's there to help you be healthy and well. They don't think about it until the moment you come in and mention it to them. And they stop thinking about it as soon as they see their next patient. Because that's what we do as healthcare providers. We devote our undivided attention to each and every one of our patients. My point is this exam is very important and not just for hemorrhoids, okay? They'll be checking for tenderness, tone, fissures, or masses, which could inadvertently wind up saving your life. You can always ask the office to see if another provider there can do the exam, but honestly, it's not a big deal. No one gives a crap, but you. And you shouldn't. So, you realize you're making a big whoop over nothing, and you go and find out you have hemorrhoids. What do? Well, if you have constipation, stop it. I'll tell you how. Increase fiber, okay? That means a lot of fruits and vegetables, and there's a gang of supplements out there to help as well. If that doesn't do the trick, there's stool softeners like Docusate or laxatives you can get from the pharmacy. It's over the counter. Just be sure to check with your provider before you do. And remember to always stay hydrated. There's also topical ointments, creams, and gels that'll help with the pain. You should be able to find them in the same area of the pharmacy. Something we do at the hospital and you can do at home are called sitz baths, which are essentially little warm water baths for your butt. You sit in it for about 15 minutes a few times a day, and this helps with the blood flow and eases the discomfort. If your hemorrhoids need more attention, they just want to be around you that much, in the outpatient office setting, they can do things like laser or light treatments, use a chemical to break down the hemorrhoid, or they can do something called a rubber band ligation, which is essentially popping a rubber band on it and cutting off blood supply to it. And we all know what happens to something that needs blood and ain't getting it, it dies. Now if those tough little buggers just won't stop, come on in for surgery and we'll do a hemorrhoidectomy, okay? Ectomy meaning removal, and hemorrhoid meaning the thing we've been talking about this whole plug-in time. Bottom line is if there's blood in your stool, get help. If it turns out to be hemorrhoids, now you know what to do. So that's all from me. Easter's just around the corner and what a perfect way to dye some eggs. Deuces. Oh.